Hi there, podcast and public radio fans. Heath Drusen here, host and creator of the Extremely American podcast. I'm working on season 3, which is an urgent story about neo-Nazi terrorists and how they helped build a modern white supremacist movement, even from prison. Some of their ideas have even made it to today's White House. It's both a gripping true crime story and a timely warning about threats to our democracy. And this time, my investigative reporting is funded by you. To support the project, please make a tax-deductible contribution at extremelyamerican.org. That's extremelyamerican.org. And thanks.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. COVID vaccines have been a political flashpoint for years now, but a new study published this week in JAMA Internal Medicine is getting attention for a different reason. Researchers followed more than 1 million veterans and found that people who received an updated COVID vaccine had lower rates of heart attacks and strokes and hospitalizations and death in the months that followed. The findings suggest the benefits of COVID vaccination may extend beyond preventing severe respiratory illness and could include protecting heart health, especially for older adults and people with chronic health conditions. Excuse me. It is Wednesday, which means Dr. David Pate is joining us to talk more about this. Hi, Dr. Pate.
Hi, Gemma.
So, Dr. Pate, this study found a lower risk of heart attacks and strokes, as well as other major cardiovascular events among people who got COVID vaccines. What stood out to you when you saw those findings?
Yeah, I wasn't necessarily surprised because, as you and I discussed with listeners way back in 21, we were realizing that people were at much higher risk of developing various cardiovascular complications. Could be hypertension, could be arrhythmias, could be heart attacks, certainly strokes. With COVID, and what we saw is that when the vaccines first came out, that was one of the big benefits. It significantly reduced that risk, which was elevated for more than a year after the infection. What I think stood out to me about this study was that even at this point, now, because this study was performed in 24, so another couple years later, which, of course, as we know, by that time, pretty much everybody was either infected or vaccinated or both. But what this study showed is that continuing to get the COVID vaccine still conferred basically a 38% reduction in those risks. And so I think that one of the questions I get is, well, given where we are, do we still need to get these vaccines and the boosters and so forth? And I think what this study, and frankly, a number of other studies have shown, is that if you are older, because the greatest benefit was in those that were over 75, but it did benefit people of all ages in their study. But so if you have underlying medical conditions, they also saw the greatest benefit. So I certainly encourage people that have chronic medical problems or have that are elderly to continue to get those 2 shots a year.
So, Dr. Pate, one of the results that was interesting is that vaccinated people appeared to have fewer cardio events overall. And that wasn't just linked to those who had a documented COVID infection. So what do you think might be driving that?
Yeah, it's a good point. So that 38% reduction that I talked about was in those who got a documented COVID infection. and then they followed them, they had that reduction. But as you point out, they saw a 24% reduction across the board, whether you got COVID or not. And I think that what that tells me is that, first of all, a lot of people are getting mild illness, and they might think they have a cold, or maybe they think it's the flu rather than COVID or whatever. And a lot of people don't even test anymore. And so, probably that reduction that we're seeing is in those individuals that had mild illness. So, they either didn't go to a doctor or the hospital and get tested, or they just treated it symptomatically and didn't worry about it, but they may still have had COVID. And what we know is that infection, those increased for cardiovascular, no matter how severe the COVID illness is, it is higher in those that have illness. But this is showing that, I think that what this shows is that is even providing you protection against these cardiac complications, even if the illness that you get is only mild,
Hmm.
or even perhaps asymptomatic.
So, Dr. Pate, for people who have basically, stopped thinking about COVID as a threat, and as you said, some people even ask you, I mean, do I even need to get a vaccine anymore? What does this study tell us then about the longer term effects of an infection? What it can have on a body, especially, the heart.
Well, that's right. And so I think that, this is not necessarily unique to COVID. You and I have talked about the benefits of vaccines, for example, specifically the shingles vaccine, but that even
Hmm.
the flu vaccine, the pneumonia vaccine, a few of those vaccines actually provide protection against dementia. And then, we look at this, and I think that what all of this is telling me is that our understanding of heart attacks, strokes, neurodegenerative conditions, there we are finding more and more evidence that many of these disorders are caused by actually inflammation. And certainly we have known that for some time with heart attacks, that not all plaques in your coronary arteries are the same, and that what seems to be a underlying precipitous for the heart attack is inflammation within that plaque. And so similarly, I think what we're finding with dementia and so forth is that the underlying inflammatory condition can affect whether you manifest those conditions. And so I think that in the greater scheme of things, is that while some people are of the belief that, well, if I keep getting these infections, it's improving my immune system. Well, we have no evidence of that. But on the other hand, continuing to get infections and create this inflammatory milieu within your body is actually probably putting you at risk for the future development of other conditions, and that can be long term. And so I think that those that have hyped up all kinds and fabricated some scares about these vaccines have really done the public a disservice, because I think that those individuals avoiding vaccinations but still getting infected are probably going to be at higher risk for a number of conditions in the future. We're still learning about COVID. I think we're going to learn more, but I think that's the underlying theme here.
Hmm. So, Dr. Pate, the biggest benefits do appear to be among older adults, as well as people with chronic health conditions. So, let's say you're in one of those groups and you have not gotten an updated COVID vaccine. What should someone in those groups be taking away from this study?
Well, by choosing not to do that, you are putting yourself at higher risk of severe disease. And of course, that's your choice. But just know that as you are aging, and it's not, although we saw the highest risks in the highest range of age, the 75 and above. We've got other studies that clearly show that the age-associated risks start at least at the age of 60. So I certainly broaden it. Now, a 60-year-old, all things equal, will be less risk than a 75-year-old, but everybody, as we're getting older, your risks are increasing that you could have more severe disease. Now, if you add on to that you have underlying diabetes, you have underlying obesity, you have underlying hypertension or heart or liver or kidney or lung disease, any of those things, which is going to be true of most people as we age, you're going to have something or other. Your risks are higher. And if you choose not to get vaccinated, you are more likely, if infected, to get more severe disease, which could mean going in the hospital and dying. And so keep that in mind as you're making your decision.
So I want to talk now, Dr. Pate, about measles cases in the United States because they have now topped 2,000 for the second year in a row. And this is raising concerns about falling vaccination rates, but also the bigger issue is whether the country could lose our measles elimination status. So how significant is it that the U.S. has now recorded more than 2,000 measles cases for the second year in a row?
Well, it's both tremendously significant for some of the reasons you just mentioned, but it's also really sad because again, there are a lot of people that are misinformed, and because they're not getting good sources of information and think that natural immunity from measles is better, or that getting the measles is going to be better for the children. I can tell you every single bit of information that we have is wrong. And that most people are very unaware of the fact that measles is one of the viral infections that actually harms your immune system, at least for a period of probably several years. Meaning that what happens is the measles virus actually infects immune cells that make antibodies. And so typically with people that get measles, it destroys the antibodies that you've already built up against other things, and you have to redevelop those over time. And it varies how severe that is from person to person. But one of the risks that I think most people are completely unaware of is that the way we found this is that actually, if you look at children in the year after measles, their death rates from other infectious conditions are increased compared to kids that haven't had measles. And it's because of this immune attack by the measles virus. The other thing is, people do not understand that there are long term complications of measles, fortunately rare, but they occur, and they're tragic when they occur because essentially universally fatal. And this might occur as much as 7 or 8 years later. You think your child is fine, recovered from measles, and then they come down with this devastating neurologic condition that will kill them. So all of that is tragic, that we're going to have kids die that don't need to die because we have an extremely effective vaccine. But it does mean that uh, this is the last time that we had cases over 2,000 before last year was 1992. This is,
Oh,
we have slipped back to no better than where we were in the early 90s, and it's all because we're failing to pay attention to science and medicine, and we're going for misinformation and conspiracy theories. um, what this also means is that whereas for the past 30 some years you didn't really have to worry about your infant baby getting measles by going to travel here in the United States or being in crowds and that kind of stuff, now it very much appears that we are close to pronouncing that measles is endemic in the United States, meaning is that it's all out there. And so these poor babies are going to be at very risk, at that risk for very severe disease. And in fact, that rare complication that I talked about that can occur years later is most likely to happen when a child is infected before the age of 2. So this is very concerning. It's also very concerning for pregnant moms because there may be some of these young mothers that are in that group that did not get vaccinated. And that means that measles will be out there and may infect the mother while pregnant. And now we're going to face risks of loss of pregnancy or problems to the fetus because of that maternal infection. So all of this is totally avoidable, but it appears inevitable because our country will not come back to its senses and look to reputable sources and look to the data. And unfortunately, there are many out there that are making a living of deceiving people, and it's working.
before we go to break, Dr. Pate, I mentioned growing concern about losing our measles elimination status. What would that mean in practical terms for public health?
So it would mean a few things. Number one is that for us to continue in the Pan American Health Organization, which I certainly hope we do because we've bailed out of most other things, but it would mean that we'd have to develop a plan to address this and work on it. And of course, we should be doing that anyway. But unfortunately, the top levels of our public health governance are not big vaccine supporters. But the other thing it means is that there are going to be some other countries that likely put out travel warnings for their populations not to come to the United States because of this, just like which I would never have thought of, because typically it's the United States putting out travel warnings for Americans. Be careful of going to these various countries because they're having outbreaks. Now, we a country that previously led public health, we may be the one where other countries have to be warned, don't come here for vacations, for visits, and that
Mm.
has an impact on the economy and so forth. So it's all not good.
For the first time in 2 decades, the FDA has approved a new sunscreen ingredient. Now, experts are saying this could give Americans better protection against the sun. Why is this approval getting so much attention? And what makes this new sunscreen ingredient different from what's currently available here in the US?
Yeah, the big difference. This is an ingredient that's been used in European nations for decades, but had not received FDA approval until now. But the big difference is while our sunscreens and the protection is pretty good against ultraviolet B rays, and that's what causes sunburn and skin damage. It's not They're not that great against ultraviolet. A rays, which are a different frequency of ultraviolet light. And A is what causes that premature aging of your skin. If you've seen people with a lot of long term sun damage, it also is what is most strongly correlated with skin cancer. And the problem with our sunscreens, unless we're using a mineral one, like when I was a lifeguard, I used to use zinc oxide. If you've seen the lifeguards' white noses and so forth, that's what that is. But most people aren't going to want to use that. So most of our current products are actually absorbed into the skin where they fight these ultraviolet rays, but they can get into your bloodstream and can certainly get to unsafe levels. So the difference with the new product, BMT, that has been approved, is that it's it's not readily absorbed into our skin. So it doesn't get into your blood and all. It just stays on your skin, but it's able to work by blocking those rays while on top of the skin surface, which is not possible with most of the products we have. So this looks like it is much more effective and much safer. And many Americans are saying it's about time.
So, Dr. Pate, I mean, one of the biggest concern raised in that discussion is, as you said, a lot of sunscreens here in the U.S. you do a good job of preventing sunburn, right? But it's that it's that link with skin cancer when it comes to certain UV rays. So, how important is it that as many folks say, it's about time we finally have an option like this here in the United States?
Yeah, I think this is really important because we have seen increases in rates of skin cancer in the United States, both melanoma and non-melanoma, and I think we need to have more consistent use of sun protection. But frankly, a lot of parents have been afraid to use too much sunscreens on their young
Mm-hmm.
children and all. And now I think we're going to have products that will be, that parents will be much more comfortable in using. And the other benefit is that by introducing this into the United States, it is now going to create significant competition with those that don't contain this ingredient, and therefore those prices are going to have to come down. And I suspect that other manufacturers of the kind of product that we previously used will start using this new ingredient, and then that will give us more competition. So it will bring prices down, make it more convenient, make it more available, and hopefully Americans will use it more.
Well, as always, Dr. Pate, we so appreciate you taking time for us. We've been speaking with Dr. David Pate, former CEO of St. Luke's Health System, as well as the co-author of the book, Preparing for the Next Global Outbreak. And remember, if you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. And that'll do it for this episode of Idaho Matters. Make sure you check out our podcast feed because you can find more episodes of topics that might be interesting to you. And for more local news and headlines, make sure you subscribe to the Connector podcast. And if this episode meant something to you, text it to a friend.
So you can't see this, but hopefully you can hear it. Behind every Boise State Public Radio podcast is a team working hard to bring you stories that matter. So if you value podcasts like this one, please support them. Hit donate at boisestatepublicradio.org. Thanks.